All right. So you have probably heard somebody say, hey, brother, sister, once you serve, the VA gives you free health care forever. And then someone else says, nah, man, nah, sister, you got to be 100% or you pay co-pays. And then your uncle who served in like 1989 is like, don't listen to anybody. I've been going for free for years. So who's right? It's all confusing. You really don't get explained if you get health care for life or not as a veteran. Here's the truth. Some veterans get free health care for life. Some veterans get partially free health care. And some veterans are out here paying copays without even know that they should not be. So let's get right into it and let's clear this thing up, okay? As a veteran, you've earned the right to quality health care after your time in service. But what exactly does that look like? Do veterans get free health care for life or not? VA healthcare benefits offer comprehensive coverage, but eligibility, costs, and lifelong access depend on factors like your service history, disability status, and maybe even your income, right? In this live stream, I'm going to break down everything so you understand what your options are and how to maximize your benefits, okay? VA healthcare is not entirely free for all. There's potential for lifelong coverage, keyword potential, and eligibility matters. So, who qualifies for free VA healthcare? Understanding who qualifies for free VA healthcare starts with your military service. According to the Department of Veterans Affairs, you're generally eligible if you served on active duty in the Army, Air Force, Marines, Coast Guard, Space Force, or National Oceanic in atmospheric administration for 24 months or 2 years consecutively. In addition to the time component, you must have an honorable or general discharge. However, veterans, peeps, there are some exceptions. If you served before September 17th, 1980, or if you were discharged early due to maybe a disability, you got med boarded, hardship that was caused or made worse by your active duty service, or early out, you may be able to bypass the 24-month minimum active duty requirement. National Guard, reservists, all you members qualified too, as long as you were called to federal active duty, not just training, and serve the entire period for which you were called. Okay. Enhanced eligibility boosts your priority for free or low cost care. This includes veterans. Maybe this is you listening with service connected disabilities rated from 0%. Yes, 0% is a service connection to 100%. Combat veterans from post 9/11 conflicts, free care for service related issues for up to 10 years post discharge. Okay. Purple Heart recipients, former POWs, prisoner of wars, or those exposed to toxins like Agent Orange or burn pits. Maybe you're a veteran who served in specific locations and during certain time periods during the Vietnam War era. If you're a low income veteran qualifying, you may qualify through a financial assessment. Okay. The VA assigns you to one of 8 priority groups upon enrollment, with priority groups 1 through 4 often getting free care. That means no copays for inpatient, outpatient, or preventative services. So, for example, if you're a 100% service connected disabled veteran, you are in priority group 1, fully covered for life. What veterans are not eligible for VA healthcare? Okay. Millions access VA benefits. Not every veteran sells smoothly into VA health coverage. So, who's eligible? Who's not? A dishonorable, bad conduct, or other than honorable discharge can bar you and eliminate you outright. However, veterans, if that's you, you can apply for a discharge upgrade or request a VA character of discharge review to potentially restore eligibility. Short service is another disqualification, unless it was for a service connected disability. Reservists, National Guardsmen who have never served a federally ordered active duty assignment are also ineligible for VA healthcare. And while Vietnam era veterans from certain locations maybe Guam or Thailand bases get presumptive eligibility for toxic exposure, PACT Act, those without qualifying service may end up falling short. Even if you meet all the eligibility requirements, income thresholds, money might bump you into a lower priority group, and you may have copays. The VA's financial assessment determines this. It's a very straightforward but pain in the butt and crucial process. If you're unsure of your qualifying status, don't guess or assume the worst. Contact your local VA, okay, near you for a review, okay? Do veterans get free health care? Okay, let's break down costs. Let's break down copays. The short answer, to sum it up, is yes, veterans do get free health care. However, it often varies. VA healthcare benefits aren't basically just a huge blanket free life promise, but they're designed to be affordable and to be comprehensive for those who qualify. What do you get? The VA offers a wide variety spectrum of coverage, including preventative care, immunizations, screenings, hospital stays, surgeries, mental health services, dental, in select cases, 100% service connected P&T veterans. You can get dental, not your family members, but you can get dental, everything but braces. Okay, you can get dental care, cleanings, stuff like that, fillings, etc. Or they can refer you out to community care if your local VA is backed up and doesn't offer or is backed up on the dental services and you're 100% P&T. You can get long-term care, including home health aides. Urgent care is covered at VA facilities or through community networks with rules for non-VA emergencies. The cost of coverage, it all falls on your priority group. Remember, there are 8 priority groups. I don't know what priority group you fall into, but if you're a 100% disabled vet, you fall into priority group 1. And it is dependent upon your income level. Priority groups 1 through 6 typically face minimal or no copays veterans. As of 2025, outpatient care copay rates, lower priority groups 7 to 8 might pay 15 to 20 or 15 to $50 up to $50 per outpatient visit, depending on the service type, or 20% of inpatient costs. But waivers exist for financial hardship. No one is turned away due to an inability to be able to pay. Let me say that again. No one is turned away due to an inability to pay. Enrollment requires a means test for most, ensuring low-income vets get free access to VA healthcare. Again, if you don't have service connection and stuff too, you should be able to get that. These benefits can be lifelong, especially for disability related care. Just keep in your mind, if you aren't service connected right now, try to get service connected. And remember, 24, let that number stick in your head, 24 months of consecutive service, unless you got out due to a med board, medical discharge, or something other. Okay. Very, very important gold nugget here. Higher disability ratings from your VA claim can elevate your priority group. Okay. Higher disability ratings from your VA claim can elevate your priority group and reduce costs, making it very worthwhile to file if you have not already done so. If you have not done so, do it. If you need help, reach out. We are here to help you to be in the best position to win your claim. Okay. Do it. 904-605-0431, info@veteransclaimservants.com. Reach out. Okay. Do you need health insurance if you have VA benefits? No, but it is sometimes a common misconception. VA enrollment satisfies the Affordable Care Act's minimum essential coverage, so you will not face penalties. With that being said, VA healthcare works best when layered with other plans. Medicare, if you're retired, TRICARE. VA coordinates seamlessly, billing Medicare first for dual eligible benefits, or for veterans, TRICARE or employer insurance. They complement VA healthcare without reducing your VA benefits. In fact, having private insurance can cover gaps like non-VA providers for convenience. Okay. So just understand that as well too. So do veterans receive free healthcare for life? For many, especially those if you have a service-connected disability, combat service, or low income, The answer is yes, with lifelong access to top tier care. However, eligibility is not always automatic. Okay. Very, very, very important. So, veterans rated 100% permanent in total, you're fully covered. Everything from primary care to specialty care is free to you. Combat veterans, OEF, OIF, you get 5 years of free healthcare after you separate. After 5 years, it depends on your disability rating or your income. And for my fellow warriors with lower ratings, veterans with any service connected condition, that specific condition is always treated free for life. So if you're 10% for your knee, all knee care free, migraines free, hearing loss free. You get the idea, okay? If you're a lower rated veteran, that's why I tell veterans get the benefits that you can, because it's so much more than the monetary value. It's your health care, prescriptions, all these things, okay? So, very, very, very important. Another thing I want to point out is if your disability rating is 0 to 40%, the VA still covers your service connected care completely, but you may have copays for stuff that's not service connected. That's 0 to 40%. When you get 50% or above, medications and so forth are covered. That is a big number. It is huge for veterans if you're rated below 50%. Okay. So you may have copays for stuff that's not service connected, like regular primary care, ER visits, prescriptions, specialty care, unless your income falls below VA thresholds. That's where your income plays and comes into play, which can also wipe out copays for a lot of veterans. Okay. Here is a gold nugget. Here's a cheat code. A ton of veterans qualify for free care based on your income. You may not even know that, but you may not even know how to apply. Okay. Apply, go to your local VA, get the help that you need. Okay. Now, some veterans do qualify for reduced or free care just because of their service type, years of service, Purple Hearts, other special rules, et cetera, et cetera. If you're a Purple Heart recipient, you automatically get moved into a priority group with no copays for most care. If you're a former prisoner of war, POW, you are covered for life. Gulf War illness veterans, many treatments tied to presumptives have no copays. There are layers on top of layers, and the VA does not explain this clearly when you enroll. I hope that this is helping you out, okay? Most veterans think they owe more than they do. The biggest issue, VA copays can be and are quite often billed incorrectly. Veterans sometimes get hit with charges for stuff that should be free because it's tied to a service connected disability. Here is my advice: always check your bills, always ask questions, always document everything, and never assume the VA is right just because it's the VA. Half the time, unfortunately, they're not. Okay. So the quick answer you can take to the bank is, do veterans get free health care for life? Yes, if you're 50% or higher, PNT, permanent in total, or have special eligibility. Yes, for all service connected conditions, no matter your rating, sometimes depending on income or priority group. And no, not every service is free for every veteran. However, that all depends on your service connected disability rating. But here's the most important part I want you to know: many veterans qualify for more than maybe you are getting. Maybe that's you listening to me right now. So if this episode helped you clear things up, hit that like button, subscribe, share this with a veteran who's confused about their benefits. And trust me, we all probably know at least one. Okay. If you want me to cover priority groups, disability ratings, or how to get your VA bills forgiven, comment below and I'll make it happen. Okay. So stay informed, stay empowered. And as always, take care of your health, because you earned it, you served, you deserve. Thank you for your service to our country. Love you, care about you. Reach out to us if you do need help. Don't struggle along. Get the help that you need. Thank you for your service to our country. Till next time, I am out.